Morning, everybody. Again, my name's Dan Deshane. Thanks for joining. We're going to dig and dive right into this. This is all about brushes and the importance of cleaning brushes, and really, from our perspective, working with manufacturing and understanding how brushes should function, what their design is, and really understanding where we're at regulatory with it right now. So, really, brushes, it's our mechanism to clean, right? As we dig into this, we're going to have a couple of objectives that we're going to go through. We're going to review the importance of proper cleaning. We're going to discuss, proper brush sizing, and then talk about, regulatory manufacturers IFUs, best practices, and some of those standard operating procedures that we're following today, and maybe ways we can get better on them. So as you will probably catch on, brushes are a very important tool in my mindset and in our companies, but also for the marketplace. And a lot of this has to do with very simple, right? I grew up in this industry, started with a company called Spectrum Surgical about 19 years ago. And one of the things that was really put into our head early on, if it's not clean, it can't be sterile, right? And there's no such thing as sterile blood, sterile bioburden. Again, scopes, we have a different level of, either high level disinfection or sterility. But the truth is dirt, bioburden is bioburden. And, all of our regulatory tells us the same thing, right? That thorough attention to cleaning is crucial for anything we do in this space, right? It really is that important. And, what causes our lack of detail? Time, right? Working too quickly, forgetting the process. We get tired. There's lots of factors that we fight every day in this space. But from what Amy tells us and from what we know just from, some of the things we'll cover today, we really need to have those details down when we start to look at cleaning flexible scopes, because there are issues in everything we do every day with these. And that's really what we're going to dig into on some of this. So Amy also tells us that the most crucial step in reprocessing our medical devices or our flexible endoscopes is that meticulous manual cleaning. And I know there's a lot of great, tools out there today, from automated, reprocessors and other versions of cleaning. But the truth is, every statement we read through any kind of regulatory body, educational body, they all tell us this one thing: that manual cleaning step is the most important. This is really a trade that we work, right? This is a trade show, or a trade, just like a carpenter or a plumber. When we work on these devices, this is a trade. And the only place we learn this trade is, during use, right? And it's a very difficult thing to learn. And so we're teaching each other as we go along, but this manual cleaning process, this is our most difficult. So think of it this way: on a brush front, if you walked in the door and you're a plumber, and I give you a hammer to do your plumbing, duties all day long, you're not going to be very successful. And a brush is the main part of this meticulous manual cleaning that we need. And that's really why we got to focus more attention to it. And as we go through this presentation, you'll maybe have some of those questions of why haven't we done that? So in today's world, we are talking about these two terms a lot more. Obviously, we've been talking about bioburden for a long time. It is the general statement we make in sterile processing, GI, or any place we're, really focusing on cleaning medical devices. Well, the one thing that we are talking more about, and I'm very happy about it, is biofilm, right? So, in simplest terms, how do we describe biofilm? And a lot of people, define it different ways. I just define it as that growth potential, right? It provides that environment for bacteria to grow and survive beyond just being out there, right? It really is that bacteria space. And that's why we need to talk about it. Again, biofilm is not new. It's been around since the dawn of time. We know it's been here and what it's been doing. So what do we get into when we start talking about biofilm and its formation? Well, first is we have bacteria. I'm sure we all agree we have bacteria in everything we do. We have bacteria in every walk of life of what we do. And then the bacteria we encounter in cleaning medical devices is obviously often bacteria that we don't want to be passing on to other people. But we have that bacteria that gets stuck to our surfaces. In the world of flexible scopes, that bacteria is in the channel that is really causing us the biggest problem. So what's next is we have that formation of the biofilm that around that bacteria. That then provides that home or that place for that growth potential. That's where that we start to see that bacteria growing. And there's plenty of studies out there today that show that we're finding lots of biofilm growing or being left in our channels of our flexible endoscopes. And it's because of not doing the right cleaning or missing steps, or even in some of the things we'll talk about soon, is we're doing the proper cleaning, but maybe we don't have the right tools for the job. And so what's the last part about this? So when I make comparisons on biofilm for most people, a couple things that I always bring up is, one is you go out to a lake or a stream and you find a rock with some kind of slime on it, right? Or you find a rock with moss growing on it. How does moss grow on an inanimate object like a rock? The one that none of us really like to think about all that much is plaque on teeth, right? How does the plaque on our teeth adhere and grow and become worse? Well, it's really biofilm that's in our mouth. So what's the other part of all of this? That moss on a rock, the plaque on our teeth, right? There's a release phase of this. So we have that bacteria that's part of that, and when we're touching that, brushing our teeth, rubbing things on patients, because that's where these devices are used, or flushing or moving things through channels, we have a release of that bacteria. And that is really where we start to run into a lot of our issues with infections and other things that can happen from this. So what influences our biofilm today? Well, first we have time, right? What is our processing time? How long does it take us to move along our devices from point of use to cleaning and have all of that done? Now, blood and bioburden typically only takes 20 to 30 minutes to dry on our medical devices. Obviously, we know from that is things that dry are a lot more difficult to remove. I often just, let's just say you throw, spaghetti on a plate and you leave that on a plate for 30 minutes. How much more difficult is that to get off, right? And that's our challenge. That time is everything to us, especially in areas like a flexible scope channel that we can't see the inside of. So the next one is number of cells, right? What is present in there? What type of bacteria is present in there? Are we flushing our channels the way we should at all times to try and reduce what's being left in there by the point of time we get to cleaning? Flow rate or fluid rate, how are we flushing and how are we doing this? But if I just brought up a couple things, right? A rock that lives in water that has the biofilm that grows on it. Plaque on teeth. We're putting water and other solutions through our mouth all the time. So that flow rate or fluid rate is a big deal when we start flushing our channels. Physical characteristics. All of our medical devices today, especially flexible endoscopes, have tons of places that we can't see, or nooks and crannies where things are hidden. We need a good tool to do that, right? We really need to dig into that. And then chemical characteristics. There are a lot of great solutions on the market today. I'm not going to knock any of the soaps or anything that we're using to clean, but I don't know one of them that says they specifically remove all of their biofilm. So the other comparison I make to that, when we just start thinking that chemical will do the job, do you go to the dentist and you go to a new dentist and they tell you, hey, I got this great new way to brush your teeth. You just take toothpaste, you squirt it in your mouth, you swish it around and you spit it out. Your teeth are all brushed, you're all good. Well, we know that's not accurate and we're not going to go back to that dentist. But the truth of that is the only thing we can really know for certain is if we put a good brush in our hands, we're going to do the job, right? And that's really what our goal is for that. So what is the biggest part of this and what can change every piece of this? It's you and I, right? Let's start having these brush conversations and let's start looking at the ways we can make all of this better. Because the reality is this, right? We call it our chain of infection. It's pretty simple. We all agree we have bacteria in everything we do. We have patient one. We have a scope used on patient one. That scope is inadequately cleaned. That scope is then used on patient two. Patient two gets an infection, right? Now, the reason why this is a cycle and a circle, it is pretty obvious, right? We don't catch that problem we don't fix the problem, this isn't just patient 2, 3, 4, right? It just keeps on going on. It's not just patient 2. We're going to continue to have that same problem if we don't find ways to fix the problem. And here's the reality, right? So we see this all the time. 2015, the FDA put out a letter basically saying that there is a problem with bronchoscopes and numerous reports of residual contamination and infections falling, from those scopes. And that is really what, we're talking about. Even if people have used and followed their manufacturer's IFUs, we're still seeing problems with this. And, this is a great article I read just talking about this. They did the study here, and I give them credit they do a great job. The OSTEATS team really does a great job of pulling great data and doing work. But you know what? They did a study, and they went to all these hospitals, and they found that 58% of these patient-ready bronchoscopes had bacteria or mold inside them. That is a huge 58%. They also said this was, not just for ones that weren't following the process or what was in the IFUs. They said that a lot of this was, from, people actually following their IFUs on this. So driving this home, is it sterilization? Is it high-level disinfection? There's lots of factors that fall into this, but we're still finding issues and problems with dirty scopes on a regular basis. And how do we fix that, right? From our processing side. So we got to dig into our cleaning guidelines. I'm going to go through, the ST7 or ST91 guidelines, on this, and really dig into some of this, and then start talking about the brushes we have to use for this. So ST91 gives us some specifics on, what we're going to be doing when we, our cleaning methods, and they give us a lot of steps, right? And so a lot of these steps are great, right? Follow the number one here's follow the manufacturer's written IFUs. I got no problem with that. We'll dig into some of my issues there in a few minutes, and then, the type of cleaning solutions, accessories, and equipment to clean the device, cleaning solutions, right? Dig into the manufacturer's IFUs for those cleaning solutions. And then, any of that processing equipment, manufacturer's written IFUs. My problem with these steps is nowhere in here. We've talked about how the need for meticulous manual cleaning is out there. Nowhere in any of this does it actually tell you to use the brush manufacturer's IFUs. There's a big difference here in between what we're talking about, manufacturer's IFUs of devices versus manufacturers of brushes. Nobody you're buying a brush from today is a brush manufacturer selling directly to the medical industry. I don't care your scope manufacturers, they don't make their own brushes. Your vendors that you buy them from, they don't make their own brushes. There are brush manufacturers in the world that make brushes. The people that sell us all the other stuff don't make brushes. But I don't see them listed here anywhere and focusing back onto that attention to detail. Now, granted, we can give them all the specs and we can give them ideas, but really those people are the most knowledgeable people in the world when it comes down to making brushes and how they should be used. And that's where we should really be spending so much time. So it also gives us all these great manual cleaning steps, and we dig into them and going to start talking about them a little bit here. But again, driving into understanding the manufacturer's IFUs. So in manual cleaning steps, it tells us if brushes are used, I love that statement, are used, follow the endoscope manufacturer's written IFU for the type of brush to be used. That's good. But the problem I'm going to show you in a few minutes here is, do the manufacturers know what type of brush to properly use? Have they done any research? Is there anything out there on that from third party or from the brush manufacturers? Again, this is pretty vague. It's just throwing it all back on the manufacturers. So this slide didn't come out that great, but clean all the valve cylinders, openings, all of our forceps, all of that with a cleaning brush of length, width, material designated in the endoscope's manufacturer's IFU. Okay, Well, I'm going to point out some things to you on manufacturers' IFUs and in regulatory. What does really length and width mean? How do you know what length and width and how that is designed, and who chooses that, and who tells you what that right length and diameter is? I don't know that I've ever read that in anybody's IFUs that specifically states why they chose the length and diameter that they have, and really digging into that sizing of the brush that is designed for that. So we have this big problem with elevator channels, right? And again, I think AAMI is a great organization. There's great people that work and sit on these committees. But when we dig into this, in my mind, all we've done is kind of kick the ball down the road here on brushes, because we have a lot of good things in here, but we're relying on the manufacturer of the medical device to tell us what is the best brush to use when they don't even make the brush, or have they done any studies to say that brush is the right brush. It's not the manufacturer that scopes, problem in general. I wish they would, invest some more time. But even as third-party vendors that sell brushes, we should be investing more time. And then when we start to dig into and look at a lot of our steps in these cleaning steps and our regulatory, they're very vague. We have really kind of not put a lot of effort into the brush world in this front. So again, it's giving us great things, brush, are any accessible channels. Get into those, right? We need to look for any visible debris, checking all that. But once again, the simple statement is use brushes of the length, width, and material specified by the endoscope manufacturer's written IFU. Now, I've read a lot of these manufacturers' IFUs, and we're going to go over just a general one here in a minute. No, the other big thing here is, wash, rinse, and repeat. I love this piece of it. Use the endoscope manufacturer's brush or an equivalent cleaning device. And then it shows us a standard here in ST91. I've worked with many, 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 many brush manufacturers around the world. Brushes are not just manufactured in the United States. They're manufactured all over the world. And so this standard that is in here, I have an issue with it. There's nobody that follows it in the brush manufacturing world. It doesn't exist in their terminology. The other side is there's nobody to monitor that. So the manufacturers don't use this standard. If you're not using a standard and the standard is not proven out in any way, how are we, referencing it? The one big thing here I will agree with on this is repeat cleaning, brush and rinsing steps until there's no visible residue coming through. That is a complete, that is what we need to do. Our brushes need to be our tool that are going through that channel, time in over and over again until nothing comes out of there. But we really do need to find those proper tools, and we need to give you better ways to decide which is the right brush for you to be using. So I travel the country, I go in lots of places, and people bring me in when they're having struggles with cleaning, devices, and they say, hey, we're really struggling. I walk into a facility and I saw all their brushes laid out. And, right now, I used to believe that in our industry, it was specifically stated that we should only use, single-use brushes on flexible endoscopes. Well, the truth is that's not actually accurate. So use cleaning brushes that are either single-use and disposed of after cleaning, that's preferred, or reusable and clean, high-level disinfected or sterilized after each use according to the manufacturer's written IFUs. All right, so again, there is no manufacturer's written IFUs on specifically how to sterilize many of these brushes unless you're going to the brush manufacturer, and many of them don't have IFUs on sterilizing or high-level disinfection. I don't know one brush manufacturer that has ever done any studies on high-level disinfection. So my problem with this statement is we can't back it up. We can't really sit here and say that we know how to get a sterilized or high-level disinfected brush. This is an image I took of a brush that was reused in a department that was supposedly cleaned, and I put it under luminescence, and as you can see, that is definitely not a clean brush. And this is my issue with a lot of these type of statements is we keep on just pushing back at manufacturers' IFUs, but there's nothing there. These manufacturers haven't been pushed to put better knowledge of brushes in their IFUs. We're struggling with that, and then we rely on those manufacturers. And it's not their fault. We haven't, they're not brush manufacturers. They're just buying brushes from wherever they can get them, and they're going in that direction. They don't make the brushes, and I don't blame the manufacturers for that. I blame us in the industry for not doing a better job of regulating ourselves, but there is truly no regulation when we come down to this. So my viewpoint is it follows by what Amy states, but I mean, really, Amy doesn't tell us that, a brush is a single-use item, but single-use cleaning implements should be discarded after every use. Very simple, right? One channel, one brush, throw it away. I can't tell people what the right stance is because I really listen to what our regulatory folks say. So I think we need to work on this regulatory more and get it better, because the truth is, what is the difference in between these terms, right? We don't really define them. What is single use? Well, in my mind, single use is one device, one brush, we throw it away. Disposable is just what I said. A single use is disposable. What is reusable? Well, by everything we just read there, right? And whatever we call it, if we're cleaning that brush, sterilizing that brush, and using it on more than one item, it is technically reusable. But what do we do with every single one of these brushes when we deem them no longer good to use? We throw them away. It's disposable. All of these brushes are disposable. There's only two differences here. If we term things single use or we term them disposable. Reusable is a relative term in both of these, right? If it's single use, we're not going to reuse it. But we need to understand what the differences in these terms are, because we have the terminology incorrect and we often don't define it well. So our end users or our people actually cleaning the scopes understand the difference of this. To me, most of what we read in this is marketing. So single use to me is very simple, right? We can make that very simple. And I think in the industry, when we start talking about flexible scopes, we really should be using that term more than not. Now, let's talk about how these brushes are manufactured. If you take a brush that is labeled single use, I can tell you right now from the manufacturer's perspective, they don't make this brush any cheaper or less expensive or do anything to that brush to make it single use. If you wanted to use it at home and use it on 20 different items to clean, it's not single use. It's not going to dissolve overnight. That's not how these brushes are made. So in this regard, again, it's all about how we regulate this and what type of wording we use when we start to talk about marketing. And that's what's really driving this. And that's why we need to drive these conversations. One of the things I really hope that people get from this, I don't have answers right now. And the reason I don't have answers is because we haven't done a strong enough job of regulating this important tool. And that's really where I hope that our thoughts go to this, is how do we start to regulate this better? Because you know what? It gives us great tools here, right? Cleaning brush, rinse, reuse, all those removable parts. We want to clean that manually, move any of the endoscope valves during cleaning. We have good overview of how we clean. If you've ever dug into manufacturers' IFUs, they give us that as well. But what we really need to understand when the brush world is what we're doing to use those and how we're choosing those better. Because again, here, just finishing this off in our ST91 information, again, it comes back to this very simple statement. And I've read probably 100 articles, different articles, trying to come up with good conversation point for this. And almost every one of the articles I read repeated this statement: meticulous manual cleaning. It's really simple. What is the number one part of meticulous manual cleaning? It's a cleaning brush. And how much time have we spent on choosing those? How much time have we spent in educating our staff on what a good cleaning brush is? I would argue that we probably have spent zero time. Comparatively, how much time have you spent choosing your soap versus the brushes? And if you just relied on saying, hey, it's my manufacturer told me of the scope that we should use their brushes. It's in their IFU. Do we question the brushes they're providing us? Again, we have big questions here that we need to address, because every place we read it and everything we see the same statement: meticulous manual cleaning. So just using a brush manufacturer's information in IFU for an example. So I went through this IFU and, I went through to check and see what brush information they had in here. So I went and I pulled out every brush statement they had in this manufacturer's IFUs. Now, I've read a lot of brush manufacturers, or not brush manufacturers, I know those IFUs as well, but I've read a lot of scope manufacturers' IFUs. And I will tell you, they're all fairly consistent in what they talk about when they talk about brushes. Here, they have two great pictures of brushes, and they describe the function of them, right? Where to put them. My question on this is, do they give any description of what makes these brushes good or bad for what the description here of their function is? They do not. Well, didn't we just see in our regulatory information that they said we need to rely on our brush manufacturer, or our scope manufacturers and device manufacturers, to give us the proper information on the right brush to be using? What if we don't want to use their brushes because they're more expensive, or we don't feel they clean that well? It's not giving us anything, and our regulatory didn't either. We're missing that piece, right? So let's go on in this IFU and see what else is in here. So this is the one, I love this statement here, right? This gives you inspection for when you're opening up a new brush before you use it. And then also, if you are going to reuse your brushes, it gives you some simple things here. And a lot of this is, to some extent, in my mind, legal stances on making sure that they give you the, hey, we're covered if something goes wrong. But I'm going to tell you right now, this says to remove the brush from its packaging just prior to use, okay? Confirm the tip and the bristle head at the distal end are securely attached, and then check the brush head for loose or missing bristles, which is already an issue, right? Just in that statement. Check the bristles for any damage. If the bristles are crushed, right? So we hit a brush and the bristles are crushed, gently straighten them with your fingertips. I've been selling cleaning brushes for 19 years. If their bristles are crushed, you are not gently fixing them. That brush cannot be used. But it doesn't say that. It says you can fix that brush with your hand. Our number one cleaning device that is used, this IFU is telling us you can fix it. You can't. It's not any good. It needs to be thrown away, and you need to start with a new one. Brushes are that important to what we're doing. We can't let this become our standard of, we're just going to, we can fix those bristles by our hand. I don't know anybody that is working in SPD or in GI or any place else where scopes are used that can actually know anything about the manufacturing of brushes to know if that's good or not. And so I would disagree with any of these statements, right? So brush manufacturer, repeated usage. Now, they just told us we can reuse these brushes. And I agree with this statement by the manufacturer, by the way, where they come out and say repeated usage of these brushes might cause the brush head to become bent or kinked. Decontam is a very hard job. People that work in decontam, it's a struggle. It's a hard job to do every day. Why would we ever want them to use a tool that isn't in good working order? If anybody's ever tried to build a deck or build construction or do any of this, right? What is the one key thing? It's having the best tool for what the job is that you're doing. Again, we don't send, carpenters out with plumber's wrenches and tell them to go fix things. It doesn't work that way. But we don't really confirm what is the best tool. We have no we have no white paper studies on what the best tool on any of these brushes are. We haven't spent enough time on it. But again, we all agree it is the most important thing that we're going to be doing every day when we start cleaning our medical devices. So again, they give us good information on cleaning the external part of the scope, right? give us good areas. The IFU shows us where we should be cleaning, and that, a lint-free cloth, sponge, or brush. Again, I want to go back to the AAMI guidelines there. It told us that all the information for choosing the right brush, the material, would be in this IFU. So if I'm cleaning this scope, it doesn't say that anywhere. I don't know what the right material is. It doesn't say this in this IFU. Some do, most don't, and even when they do, it's very vague or it's non-specific, and I often would question, where did they get their information, and do they have white papers that can prove that kind of brush or that style of brush is the one that works the best, right? So brushing all channels, again, just going through this information, it gives us all great things, gives us a great areas that we need to focus on. It has a picture of their brush. Again, no specifications to what makes this brush good or bad, and no specifications to making sure that this brush is going to do the job that you need it to do every time you pick it up. So this is the one I always get more interested in. What does the brush manufacturer think, right? So brush manufacturers today do not sell directly into the healthcare market. They do not. They make brushes for multiple different industries, from gun brushes to mascara brushes to everything. That's what they do. They are brush manufacturers. They make cleaning brushes for every type of industry across the, marketplace. That's what brush manufacturers do. They do not spend all of their time in hospitals digging in. They expect that us as vendors come to them with good ideas and good thoughts. But the brush manufacturers often are not really doing a lot, and I've worked with a lot of them. And I've worked with a lot of the ones overseas that really don't have any drive to follow any guidelines behind this. They're just creating a brush that they think is going to work. Now, a lot of these brush manufacturers, and there's some really good brush manufacturers in our industry, they want to learn, they want to know, but it's only left up to us to teach them what's going on in our industry. And that's what the brush manufacturers think, is they want to learn. We just have to set standards for them, and we have to set standards so that they know how to do the things we need done correctly in the brush world. So selecting your brush, right? So size really matters. This really isn't all that complicated, especially when we start talking about flexible scopes. Again, we just went through all of the areas that need clean. We're literally talking with a brush, 3 or 4 areas that need to be cleaned on an endoscope, right? We have external cleaning, and we have internal cleaning, and we have valves and ports, and then we have accessories. That's really what we're talking about. But when we start getting into selecting a brush, our brush manufacturers do give us the mindset of how they've made their brushes. And that's what we should be focused on, is what the brush manufacturer, when they made the brush, what they think the sizing is for how it fits. So AAMI ST79 is the only one that really gives us some direction on this. They say the lumen with a brush that is the correct size, and that sizing is diameter and length, and the correct bristle type. Let me tell you today, again, we're getting, all of us, mostly the brushes from the same manufacturers that make brushes for the medical industry. The type of bristle head you're getting today, it's a natural grade or a medical grade nylon, antimicrobial, something we'll hear often, those kind of things, but it's all pretty similar. But my issue again with this statement here, and I think AAMI's done a phenomenal job, and I appreciate all the people that sit on those committees and spend a lot of time doing it. It's a really difficult job, right? But it tells us that appropriate size, but it doesn't tell us how to choose that appropriate size, and we have a disconnect here. What is appropriate size? Our manufacturers of the devices that we're cleaning don't know what that is. They're not giving it to us. The only people that truly know how to choose that are the people that make the brushes and how they design them to be used in devices. And so my argument always here is we're actually not giving you as end users good enough information. So let's dig into this. Length, diameter, our valves and ports. Well, length is very simple, right? So anything that we ever clean, we need to see that bristle head exit out completely out of the other side. We can't see in these devices. We know this. but we need that bristle head, the entire bristle head, to exit the other side off so we can clean it off before we pull it back through the scope. Or even if you're doing a pull-through style where you're pulling that through and feeding back in, we need to clean that brush off over and over again, like we read in the regulatory, so that we know that that is clean and there's nothing left on that brush. Regulatory does a good job. The manufacturers IFUs do a good job of describing those steps and making sure there's nothing dirty or left, right? That rinse and repeat. You know, valves and ports, you know, we see all kinds of different valve ports brushes. I was in the repair industry for a little over 15 years. And one of the dirtiest areas we often see when these devices get taken apart is some of these valves and port areas, because we forget to put our brush into them, or we don't have a designated valve port brush to remind us to clean those. So we're just using the end of the scope brush to try and clean the valve and port. I would always recommend to people, look at a valve port brush for this, right? So diameter is something we're going to dig into, right? So what is the proper diameter size, right? How do we select diameter size, and what does that mean? In our industry today, we've done all of our end users a disservice to some level, right? If you go in and you can pull it up, there's hundreds of different size brushes all on the market, from a 1.2 to a 2.2 to a 2.4, right? All in millimeters, or the inches is even more confusing when we start talking about inches, because most of our devices are measured in millimeters, and then we add inches in there, and we got to figure out conversion, or we have a nice brush scale that we have to try and figure out conversion. But has anybody ever taught you how we actually choose diameter? For most part, we either rely on the manufacturer of that medical device to say, okay, this is our recommended brush. They don't tell you why they chose the diameter for it, or what that bristle means, or that it cleans well, or we just go out there and try. So we actually call it the Goldilocks perspective, right? So what is that Goldilocks perspective? Well, first is, what is too large? Too large, it just won't fit in the lumen. It's really pretty much that simple. It just won't go down our lumen. And we got to remember, though, in this is we have the next step. What is too small? And why is it too small? It's not going to touch all the walls. So a lot of our brushes can get bent up, but what's the bigger problem here? And why do we use a brush that's too small sometimes? We know we have to put a brush down that channel. That channel, and that lumen is loaded with blood and bioburden. How do we get something down that channel? We end up going with a smaller brush to push it down there. But the truth is, when we hit that smaller brush, we actually aren't cleaning. Think of anything. If the bristles aren't touching, it's not scrubbing. So that takes us to what is just right, right? So I'm going to make a little bit of a statement here. When I talk to my brush manufacturers, in their mind, when they create a brush, they optimally create a millimeter brush. I'm not talking about inches or anything else. I'm talking about millimeters, and we dig into it. Their optimum mindset is they're creating a brush that's 2 millimeters larger than the channel it's got to clean. So those bristles, I was out in California a couple weeks ago, and I made the comparison to a snowplow. If you've ever seen how a snowplow works, it pushes things off to the side, but it comes out to a point, right? Or it pushes. You actually need those bristles to move backwards. Most of our brush manufacturers, that's how they're making these bristles. They're designed to move backwards and give you that scrubbing action as they move backwards. It's in how the brush and the bristles are cut, not just by looking at them and squeezing them. It's how they're cut and how they clean and scrub. Now, the good news on this is, when I talk to our brush manufacturers on this, they say, listen, you don't have to be perfect anymore. It's not about being 2 millimeters larger than the channel. It's just about being larger. There's a large difference in between, smaller or too small and getting to too large. So if we're 1 millimeter larger, it's a very small measurement of millimeter. We're in good shape. 2, 3, we're okay. The whole key is being larger. And that's what most of our brush manufacturers are telling us today when it gets into that. So we're just I'm going to go through these pretty quickly, because this is what we've done that actually confused the marketplace. And, we've made it harder in choosing a brush, right? So we see all kinds of different styles out there. Now, I am going to point out when we start to look at tips on brushes, there's a very big difference in cleaning general instruments and having tips versus cleaning an endoscope or a flexible endoscope with a tip, right? So it's about the material. Having a tip on a brush that is cleaning a stainless steel is not necessary, because the wire twist or any of these that are made with brushes is a much softer metal. They won't damage the inside of your stainless steel. Conversely, the material that is used for the inside of channels in flexible endoscopes could easily be damaged by stainless steel. Any brush we ever put down a flexible endoscope needs to have a tip on it. These are designed to protect the inside of those channels and not cut them and allow fluid invasion. But again, there's many, many different styles of these tips that we're going to see. I can't tell you one is better than the other. I can tell you this: if you are throwing away your scopes or your brushes after every single use on a scope, you should look at less expensive ones. These more expensive tips aren't giving you any better, and they're not proven to do anything better for you than what you're getting today, right? Lots of different styles you're going to see, from handles to other things to, pull through styles to some of these styles that have, I'm not a fan of putting any type of pipe cleaner material down the scope. Or what if we have this really long brush head? Does that speed us up any? There is no proven data or information that says any of that does that. Until somebody starts showing me empirical data that shows that, hey, we've done the study, that all these things that we've done to make these brushes more expensive clean better, then I'll believe it. But I haven't seen that yet. And I don't think anybody can provide that to you. So we have a lot of expensive brushes on the market. We have tons of different styles. I can't tell you at this stage which one is better than the other. Do we need to do a better job in our industry and as vendors of probably creating that? Yeah, I would agree. It's also on us, but it's also us on the industry of us digging in to look at all these brush styles that were created to understand what's better, right? From squeegees to other things. I'm not going to knock any of these because, again, I don't know that there's any data out there that says one of these does any better. I've researched it. I've tried to find it, and it's not there. So when we get into all of these, I'm going to tell you, get a brush that you feel confident in. You're ultimately going to be doing a lot of the testing yourself, from the external to internal cleaning, right? That external cleaning is just as important, but you are really ultimately the ones making the decision on today on what you feel is the best cleaning device for this. So I'm just going to finish up with on a couple things. One is we did some IFU review here, but please do. All of our regulatory specifically points out, know your manufacturer's IFUs. And I tell you, read through them. They're not always easy to read through, and I get that and I understand that, and they can be very confusing. I've tried to read through a lot of them, and they are confusing. Regulatory review. I pulled out, and I'm happy to provide it to anybody, in ST79 and ST91, I've pulled out every statement there is about a cleaning brush from those two documents. Right? Unfortunately, in my opinion, again, just my opinion, and I'm kind of a brush nerd, we don't have enough in there about brushes. And I think we really need to look at that. The next time we do this, we need to talk more about our brushes that we're using. Because everything tells us this meticulous manual cleaning is vital to what we're doing for our patients. Standard operating procedures. Do you have them around brushes? I know we have a lot of them, but do you have them specifically around your brushes? Have you had anybody ever do a brush evaluation or specifically hands-on training just about your brushes? I'd ask you to dig into that, look at that, and really think and take more aggressive approaches on your brushes. So that is it for me. Again, I'm sorry for the overview and not a lot of great answers, but are there any questions out there we might have?
All right, Dan, I'll hop in with you, and definitely going to encourage some questions because we do have about 10 or so minutes left. So any of you out there that have some brush specific questions, Dan, I can attest. I've been a part of just seeing IFUs. I've created IFUs on the manufacturer side, or helped, not necessarily created them, but helped write them. And there is a lot of gray area when it comes to the tools that are used to clean the tool that is there to help the patient. So it's almost as if we need a or a guideline just for those tools like brushes. But so, in terms of that disconnect, how do you see that evolving as far as, bridging that gap between a brush manufacturer and a scope manufacturer, and having them, get together and fine tune everything, and to really, have better information when it comes to using these cleaning tools?
Yeah, so I think one is, again, I think scope manufacturers, they make really good equipment, right? And they've done that for years. And the advances we've made in, endoscopes has been phenomenal in many ways, right? But as we've designed better technology in that, look at our brushes. They haven't changed in 20 years. So we see this in every step. So we really need to spend more time on that. The manufacturers do. They don't make the brushes. And, again, they expect the expertise from those brush manufacturers to understand that. I'm sure they give them their devices and they tell them, hey, create something really good for this. But again, my point to that is, if you look at these device manufacturers, they've been selling the same brush for 20 years. But they come out with a new device every 2 years. Now, I'm not saying they don't take that same old brush and test it out, but our brush technology has gotten better. And we also need to push in the industry by creating our own white papers, right? We need to start testing these brushes so we can push our, manufacturers about the devices and those. And then also, we have a lot of really good third parties in this industry that, in my mind, in ST91 and a lot of these, we pretty much just put this on the device manufacturers and not us as third-party vendors. We need to hold our weight too, because we're getting our brushes made from those exact same brush manufacturers that the device manufacturers are going to. And so we all need to, it's a combined effort. We all need to be involved in this. We need to do some work on that front.
Right. Yeah, it's not an easy solution by no means, but for sure, I think implementing or involving the brush manufacturers more in the process and holding them accountable, I think, is another standard that we need to take a look at. We do have a question here from Jennifer as far as technique, and she asks, what is the best technique to use in brushing the channels? Just pushing through, back and forth, or a twisting motion as you go through the channel? What's the best technique?
Yeah, so I get this question. I get the question all the time, right? So I will tell you this, from a brush manufacturer perspective, none of those techniques that people use is specifically stated from them, right? They say everything, right? So think of a brush that you use at home to just clean the external surface of something. You visibly see it, but you get a feel for how that brush scrubs, right? Brushes are all made a little bit differently. So is it one that's better for a twirl or spin? I think the truth is what I usually teach is one of the biggest techniques is you get as close to the end where you're going to be, inserting the brush to, and the brush that you're inserting, you want to get that as close as possible. So that's where you want to really feed. I see a lot of people try and grab or move it around and, get from the back and start pushing in. It's feeding close is the first thing, right? That's going to give you as much extra power as you can get. And then whatever type of twirling, scrubbing action you want to go, there is no data anywhere that shows one way works better than the other. Unfortunately, every part of what we have in the industry and those statements today, that is all opinion, right? Hey, I've done it this way and it seems to work great for me. And that's ultimately how we've been training how to clean in sterile processing and elsewhere in our industry for years, is we train somebody behind us, right? We bring in a new tech and the people that are doing it are training the tech. And I say that we've missed the boat There's no great answer to that question because I can't tell you that anybody's ever done any studies to say this is the way it happens and makes it better. I will say, Brett, to your point is all of the above. If you got to
Right.
twist it, scrub it, you got to scrub back and forth until you get it clean. The bottom line is that bristle head needs to exit out the other side completely, and you have to keep on doing it until you see that that is clean. And that is the only truth in anything that we know. That bristle head has to be clean every time before we're done with that brush or that scope.
Right. Yeah, and this kind of goes back to the IFU. It's in the standards. Always refer to the manufacturer's IFU, and then that's open for interpretation, as you pointed out. So, if you are going into a SPD that is trying to implement a better cleaning process from start to finish, from pre-cleaning or point of use treatment to getting to the brushes, and you kind of brushed over it just now. How would you approach a department that is having challenges with these steps? What would be the first thing that you would recommend?
Yeah, I mean, well, first is, I want to spend some time with you, right? I want to see your people and what they're doing and get an understanding for your process, right? We've seen it in a lot of the studies, OSTED's done it. A lot of these studies show that they followed the manufacturer's IFUs and they're still getting dirty scopes, right? So they followed them to the T. They're using the manufacturer's brushes. They're doing all that and they're still getting dirty scopes. So sometimes it is, all right, let's look at the tool we're using, right? Is the brush we're using, are we using it properly, right? In the sense of, are we just running it through and then not checking the end, right? Are we reusing these brushes and there's residual left on there that we don't know about, right? Could be soap. There's lots of factors that fall into that. I think the only true way for me to work with somebody on that front is let's spend a little time and talk about it. And then to simplify it, our challenge again is standard of care. If we have 20 different brushes or we have one brush, right? There's a level in there, right? Are we matching specific brushes up to specific scope models? And does our team know why that's there? I do a lot of charting for people to say, okay, hey, we're going to use this brush optimally. We've tested it. We feel that you feel that it's the best one. This is the optimum brush for what you're trying to do based on what the manufacturer of that brush is telling me, not of the IFU of the scope, but what the brush manufacturer is telling me for optimal sizing. And then we chart those out, right? Color code them or other things. Those are some ways that you can do to get to that level of standard of care. But again, my problem right now is we have no complete silver bullet for all of this.
Right. Yeah. Not an easy answer by no means. Thank you for that. Do have a couple of questions here, comments. One from Victor. The choice of brush is one thing, but how to use a brush is another equally important issue. We kind of touched on this. Some say brushes must have tapered heads first and not the bulbous part, which is correct.
So again, tapered brushes. So we got to understand most manufacturers have made tapered brushes for a specific thing, right? Valves and ports often is what they're done. A tapered brush to some level, this really comes down to preference, right? A tapered brush, if it's tapered at the front and bulbous towards the back, or it's more wider at the back, the idea is it's going to slide through that channel easier so you can get the brush in that channel, right? So it's not going to get caught up and it's going to pull and scrub. My problem with that often is now you have a brush that you're only using a small portion of the brush because now the tapered part is just helping push through and getting things clogged. There is no, again, white paper studies that show a tapered brush works any better than any of those other ones. I'm going to tell you the one part of a brush on a tip that is the very important that we talked about is having a tip on the end of that brush, because it is a wire twisted that is put into a nylon shaft. That's what 90% of the brushes we have. It's a piece of wire that's how they twist the bristle head on there, and they put it into a nylon or plastic shaft, and that's how it goes through. But that wire twist will poke a hole in the inside of that channel. That is the one thing for certain on the tip of a brush. If you're using tapered or non-tapered, there is no one that says one is better than the other. Nothing in the marketplace can make those claims, right? From the squeegees to anything else, I've not seen anybody do white papers to prove to me one of those is better than the other.
All right. Well, I think that that's probably a good spot to end on, Dan. I really appreciate all of your insight. And it does, as with all of this, there's an evolution that comes with the association and the emphasis on cleaning. I think that it's often been left out in the dust, so to speak, and we really need to start elevating the standards when it comes to those tools that are used to clean scopes and other medical devices. It's not just, I think there's a lot of improvements that need to be made, and oftentimes the standards, as we all know, are a few years behind. So we need to continue to have these discussions and be open-minded about the improvements that need to be made. So really appreciate it, Dan. Anything you'd like to add to close us out?
No, I think you hit it perfectly, right? We need to spend more time. We spend a lot of time on our soaps. We spend a lot of time on choosing our devices. But this is our number one tool that's used in decontam, is a brush. And we've underestimated it for all of these years because it's just a brush, right? But it's not. It is our number one tool. And I think we just need to spend more time focusing on how good these things could be for the job they're doing.
Perfect. Yeah, because you want to keep that cycle going without a patient being infected on the other end. You pointed that out perfectly at the beginning of your presentation. So, Dan, thank you so much once again for joining us.